Hi, my name is Jennifer Rivera, and today we're going to be talking about my Capstone proposal project. So, standard ambulance offloading times helps hospital fulfill their obligation to make sure that we have policies and procedures in line that allow EMS to effectively transfer patients' care from the EMS system to the emergency department in a timely manner. Hospitals surpass EMS offloading times for many reasons: capacity, admission delays, staffing shortages, triage issues, documentation, and coordination. This directly affects EMS response time by reducing productivity by hours while EMS is not able to readily respond to 911 questions. So, the intent of my proposal is to lay out a framework for a process improvement that will help us offload ambulance patients and reduce the time that is spent on wall times. By doing this, we also allow EMS to return to the communities they serve, making their response times better. So the way we can do this is by improving the policies and procedures that are in place so that we are able to transfer patients from EMS to ED within 20 minutes of arrival. In EMS, does streamlining implementing a new triage protocol of offloading opposed to the standard offloading procedures reduce the ambulance offloading times over a period of 6 months and improve patient outcomes? Another big part of my project is showing how early detections of things such as STEMIs by getting EKGs within 10 minutes of the patients being received by ERs helps improve patient outcomes by being able to transfer them faster to a cath lab. Other things is catching strokes faster within that initial stroke alert window and being able to give them thrombolytics, overall improving the patient's outcome far after. So, big thing with my project is I'd like to go ahead and implement a new staffing where we have 2 ED techs and 2 nurses dedicated to be able to take these patients that are coming off of the ambulances and have a set area that is situated with, we have 8 gurneys, 2 wheelchairs. At any point, if we exceed the amount of staff we have to take new patients, one of our offloading nurses can be pulled away to take a patient load of 4. In the midst of time, the next nurse can continue to load. This area is a receiving and transfer area, so these patients are not set to be staying in that area. We will be using already equipment that's provided by the hospital that we already have, but we will be budgeting in for more staff, the 2 nurses and the 2 techs, and possibly a transport to help aid us in getting these patients off of EMS, getting report, getting our time stopped by having the nurse sign off on the report and release the patient care to the ED. From EMS, there's other implementations that go into it. So as you read my capstone paper, we'll be supported with a lot of documentation as far as how much patient outcomes are better when we reduce those patient offloading times, and also how it helps the EMS system not only have a more cost-effective budget year, but it also helps get them back out there to serve the communities we need and be able to respond to emergencies. I look forward to your replies.